Welcome to Business Connection Zoom edition. I'm Liz Spencer. I'm joined today by Dr. Lawrence Kakmar and Shannon Keith, who is the practice administrator, and they're with the Center for Primary Care and Sports Medicine. Welcome. Thank you for being here.
Thank you for having us.
It's a very busy time for you. Are you all still seeing patients?
Yes, we are. This is a very unusual time that we're in right now with this pandemic, and so that's all that's getting pressed most of these days. But what's really important is there's a lot of other things going on, from other infections to even other medical problems, from abdominal pain, gallbladders, heart attacks, strokes. So my big fear is that so many people will be missed worrying about COVID when there's other issues that need to be addressed. What do you think, Shannon?
Yes, I really think that that's a big push for us, is we're not doing telemedicine simply for the fact that we want to see you in the office so we can properly assess and gauge what's actually going on. And I think really to be a good administrator during a pandemic, you really have to simultaneously run like nothing else is going alongside with the pandemic. And you can't stop what you're doing and what you normally would do just in case or for a pandemic. And that's kind of how we're looking at things.
Are you testing for the COVID-19 virus?
We are. And that's kind of go along with the first question, that we're seeing patients, and you have to say that the COVID-19 is part of the differential diagnosis with whoever you're seeing. So we're not excluding COVID. Every person, you got to kind of think, how can it manifest, how can it present? So when it's in a differential diagnosis, you have to test. And we made the decision to start testing about 3 weeks ago. We saw this pandemic coming. We saw we had to serve the community and serve my patients. So we found ways to test, and that was a real problem early on because there just was no testing being done. What do you think, Shannon?
Yes, and I think that's exactly what we try to do. And I think it's so important that we have independent practices like we have, because we are able to think outside the box. We were able to take this pandemic and say, how can we help our community, and how can we be a place they can come not only for testing, but to call and just get reassurance or even screening. And we've screened some patients multiple times just because, there is a lot of anxiety with this. So I think right away we dove into it, and we wanted to be a good resource for our community during this time more than ever.
And to kind of follow up on that question, are we testing? What we are doing is we screen people if they're within a differential. If you're sick or you're calling in for the COVID testing, we screen on the phone. And if you meet criteria, we do the testing. And just about all the testing has been done out in the parking lot to keep it outside the building, keep it safe for staff, patients, and that's how we kind of got the testing going on in the office.
How is your testing different? I mean, it seems like you're able to test and nobody else is able to test.
When this whole thing started, we were told about test kits, and we were also told that you can only be testing at certain places. And so Shannon and I, we've kind of been working at this 7 days a week, 24/7. Right. So for the past 4 to 6 weeks, just right. Even on weekends, we're here doing stuff. So we kind of set it up with our commercial lab that we could do testing, and Shannon and I were both frustrated in that the traditional test, you have to wait, usually 5 to 7 days to get results, and that's precious time when you're dealing with sick people. It could really be life or death, and so however you want to call it, we came across a lab that has approached us, and we've been using them, and we're able to get results in 24 hours now.
Wow. There's such a misunderstanding when it comes to testing. Really, there's only two pathways to receive COVID testing. And one of them is through the state, which I know a lot of people are frustrated with that because there is a limitation on it through the Illinois Department of Health. And really, you have to meet criteria and receive an authorization code to even get tested through the state. And so it's very important that clinics that have the ability to use commercial labs really use them, because this is kind of your time to shine, because we have this ability through a commercial lab. So we don't need authorization from the Illinois Department of Health. We can do our testing based upon our own screening tool that we do use, kind of based upon the CDC recommendations. And so we're able to do that, get next day results, and we don't have that period of 5 to 7 days where we really want to quickly get results so we can keep you out of the hospital is basically our aim, as it is with every other disease.
Well, and that's wonderful. That is absolutely wonderful news. And so that goes to my question of how are you handling positives? What type of intervention are you doing to keep us out of the hospital?
When this started, it was scary times. This is a new disease, a new virus, and so we're all kind of looking at it a little differently. But Shannon and I, what we put together, and we quickly came together with an approach or an algorithm to treat it like really any other disease. Every disease in this country, we screen early, we test early, and we treat early, and that's really the best outcomes. And that's how we've kind of come to what we're doing right now with the testing. And really we have we really have great outcomes because we're intervening early. And so what happens when we get a test result that's positive? We hope it's negative, but if it's positive after the screening's done and the results come back, and like Shannon said and I said earlier, what's really relieving to people is that we know the next day. There's so much anxiety associated. Families aren't sitting at home scared. People aren't sitting at home by themselves scared, we're also able to keep them out of the hospital if the labs come back positive. And what we do is we reach out to them the next day, and we follow the dual drug treatment protocol that's been out there discussed so much. Shannon, what do you think?
Right. So what it could look like for you as a patient would be you call, we do our screening tool with you, say, yes, we should test you. We will do that testing more than likely in the parking lot in your car, and then we call you. We usually get results the following evening, so between usually about 5 p.m. and 7 p.m. is when we get results, and we get these 7 days a week. So even if you're tested over the weekend, we will still call you, even if it's Saturday or Sunday. And then at that point, we will go ahead and intervene and start treatment with the dual drug therapy. And we've really seen 100% turnaround in symptoms in 2 to 3 days.
Wow, that's amazing. Thank you for taking the initiative and really helping us through this time period. And Shannon, I think you kind of covered this, but for people watching this, if they think I need to get tested or I'm fearful of I have this, what's their next move? What should they be doing?
So really, your next move is going to be, you're going to call us. So you're going to give our office a call. During normal business hours, you can just call our phone number, 630-375-1625. And there's actually an option on there for screening, and it's option 3, and it will go to a voicemail. And at that point, we will call you back and do a screening with you over the phone. You can also book on our website, www.cpcsm.com, and do a book appointment online. And there you can just put in your reason for a visit. You want a COVID screening. And that's the best way to really get a hold of us. Of course, you can always call the office and speak with the receptionist, and she'll get you right through. I know it's very, people have a lot of anxiety, want to hurry and talk to somebody. So I would definitely just call us. We're here, even if it's just to counsel you and help you know that you may or may not have it. Just because you're exposed doesn't mean you automatically have it. So I think that's an important thing to know too.
Doctor, any final thoughts that we need to keep in mind during this pandemic?
Well, just the big push from our end, which makes us different from other facilities, is that we're trying to treat this early and keep people out of the hospital. I mean, you see these horrible pictures on TV, and people need to know that's not how every COVID case goes. 90% of the cases are mild, and a lot of people just have cold symptoms, and we'll easily get through it. The trouble is that we don't know which ones are mild and which ones are going to be aggressive. So there's that 10% that we want to try to prevent from happening. And once you get in the hospital and people start talking about ventilators, and it's scary and bad things, and people are going to die, no matter what we do sometimes. So the best thing what I'm really excited about what we're doing is that we're intervening, keeping people out of the hospital, rapid turnaround. We've seen some really sick people and have had great results. And, actually we're treating this like any other disease at this point. And that's what gives me, we can approach this in a relaxed fashion. Yes, you have to follow the recommendations and social distancing. And I'm not throwing caution to the wind. However, it's good to know that whatever you're fighting, there's a treatment for it, and you can pull people through this. and Shannon brought this up too. We're doing a ton of counseling for people too. There's so much anxiety attached to this. People are afraid to leave their house. They're afraid to go get their medicines at a pharmacy if they won't deliver it at groceries. And we're trying to bring some people peace of mind that, you know, there's hope. That if you get this, it doesn't mean that it could be the end of your life, and that, you know, there's light at the end of the tunnel.
That's wonderful. Well, we so appreciate your practice stepping up and doing this vital work for us, and for you all to keep going and see patients. I mean, that's, you know, it's a big step for you. So thank you so much for joining me on Business Connection and telling me all about it. We wish you good health, and I know that you'll be serving the community. So thank you.
Thank you.
Thank you.